I'm your host, Priscilla, and welcome back to another episode of Oceania Hospital's Health Talk. We're so glad you've joined us again. Today's episode is extra special because we're welcoming back a dear friend of the show, Professor K.M. Babu. Yes, it's his second time with us, and we couldn't be more excited. This time around, Professor Babu will be helping us understand something that many people have questions about, but might not always ask about openly. Laparoscopic surgery, including a laparoscopic hysterectomy. What do they mean? When are they needed? And how do modern techniques make recovery so much easier? We'll be covering all of that in a simple, down-to-earth way. So grab a cup of tea, get comfortable, and let's dive into this important conversation with Professor Babu. So, our first question for you today, Professor Babu. For those unfamiliar, can you briefly explain what a laparoscopic surgery is and how it differs from traditional procedures?
Yeah. Laparoscopic surgery is also comes under the category of minimally invasive surgery, or it's also known as endoscopic surgery. So minimally invasive surgery and the conventional surgery is, in case of conventional surgeries, you may have to make a long cut, long wound in the abdomen and the stomach.
Right.
It can extend from 10 to 15 to 20 centimeters. So the similar surgery can be done without opening the abdomen through small instruments. So it's also known as keyhole surgeries. So the cut which is made for this keyhole surgeries will be, the biggest one will be about 1 centimeter and the smallest one can be 2 millimeter to 5 millimeter. So only multiple small incisions cut only will be there in the abdomen, and whatever complicated procedures can be done in a conventional surgery can be done through this keyhole surgeries.
Thank you. So, you've recently performed a successful laparoscopic hysterectomy operation this year. Could you walk us through how that surgery was carried out and what made it notable?
Yeah, I have been doing this laparoscopic surgery since 10-15 years. After coming here, that is the first time a laparoscopic hysterectomy was done in Oceania hospital by a gynecologist. Otherwise, laparoscopic surgeries are done by the other surgeons also. But in the Department of Obstetrics and Gynecology, the first time a laparoscopic hysterectomy was performed in Oceania hospital. So, the indication for the laparoscopic surgery is same as conventional surgery. Only thing is, the way you are doing is, otherwise conventional is open and this is laparoscopic surgery.
Thank you. Moving on to our third question. So, laparoscopic procedures are known for quicker recovery. What should patients know about post-surgery care and expected outcomes?
Okay, as far as it will be more expensive than, definitely it requires more skill and more equipments are required. So it will be definitely more costly than the conventional surgery, and recovery will be definitely faster than the open surgeries because there is no big wound on the abdomen. So obviously after the following a laparoscopic procedure, patient can go home on the next day or even on the same day. Some procedures can discharge the patient on the same day.
Thank you. So moving on to our last question. Lastly, what advice would you give to our viewers, especially women, when it comes to maintaining reproductive health and recognizing when to seek medical consultation?
Okay. Regarding the reproductive health is concerned, women should know about the reproductive physiology. I mean, how the reproductive functions are happening. What is their menstrual cycles. Then they should know when to approach the doctor. So normally, human beings are supposed to be a low fertile animal. So after trying for pregnancy for about 1 year, regular unprotected sexual contact during the fertile period of the menstruation, trying for 1 year, if it is not happening, then you should consult a doctor. Otherwise, if there is any non-problem before the marriage, then also you should consult a doctor even before 1 year.
Thank you. And that brings us to the end of today's episode of Oceania Hospital's Health Talk. A big thank you to Professor Babu for sharing his time and wisdom with us again, and for making a sometimes scary topic feel a lot easier to understand. And of course, thank you to our wonderful viewers. Your support means the world to us. Every time you follow us on social media, leave a comment, or watch us on YouTube, you're helping us keep these conversations alive and reaching more people who need them. So from all of us here at Oceania Hospitals, thank you for being part of the Health Talk family. Take care of yourselves, take care of each other, and we'll see you again very soon. Inaka.